Hey guys, welcome back to my channel. For those of you who are new here, my name is Marchelle. Subscribe to the channel. Make sure that you go follow me on my other social media platforms. All right, y'all, let's go ahead and get into this video. So as you can see by the title, we're gonna be going over just some what ifs that happen in the dental office every single day. So basically just going into some scenarios. For those of you who don't know, I am a dental hygienist. I have been a dental hygienist for the past 8 years. So of course, y'all, with that much time, you know, I have gained so much experience and so much knowledge about dental hygiene and the dental field in general. So I'm gonna come to you with a few scenarios and we could just talk about it and discuss it. So basically just gonna go ahead and break down these different scenarios that occur every single day in the dental office, especially for dental hygiene. So my first what if question or scenario is, what if my patient needs SRP but they don't want a prophy? So for those of you who don't know or are heading into dental hygiene, thinking about dental hygiene and just still learning, an SRP is basically a deep cleaning and a prophy is a regular cleaning. So basically the question is saying, what if my patient needs and requires a deep cleaning, but they only want to do their regular cleaning? And also I'll break down, just in case nobody knows, why that would even be a scenario. And that's because deep cleanings are not always covered in the dental office. Some insurances don't cover deep cleanings. Also, if a patient does not have any insurance, a deep cleaning is going to cost way more than just a regular cleaning. I feel like once we get into these certain terms like gum disease, deep cleanings, the patients get a little bit nervous. They get a little bit scared. They're like, you know, I don't know, that sounds like it hurts. Or patients have had it in the past, they didn't have a good experience, maybe their last deep cleaning was painful, and that causes them to say, no, I don't want that, I just want to do a regular cleaning. So this happens so frequently. So what do we do? So the first thing I'm gonna say is be knowledgeable. Make sure as the dental professional, you understand the reasoning behind needing a deep cleaning. You understand the importance and you understand the risk of what can happen if the patient doesn't go ahead and get this deep cleaning done. When you have that knowledge, you share it with your patients. And one of the most important things about educating our patients, because number one, as dental hygienists, that is our number one job, is education. But it makes no sense to educate and use terms like scaling and root planing, SRP, you know, arrestin, like those types of words make no sense to the patients. Even with myself in the past, why you know, patients may be apprehensive to get care done, to get you know, these deeper cleanings done, is because we're not sharing information the way that they can receive it openly and understandably. If a patient does not understand what they're getting done, they will likely not do it. We have some patients who are passive and like they might just do it. They might, you know, it might be a random or a case where they might just be like, all right, I trust you, I'm just gonna do it. But for the most part, they wanna make sure that they understand fully what you are talking about. And when it comes to people's health and when it comes to finances, because like I said, the deep cleanings are not always covered. People want to know what you're talking about and they want to fully understand and comprehend this before they're just like, yeah, just go ahead and, you know, do this deep cleaning in my mouth. It's like, no, what even is it? So once you have the knowledge as a dental professional, it's very important to use proper verbiage in order to explain that to your patient, in order to get through to your patient and stress urgency. I also believe that like we have to be personable. Like for me, I always tell my patients, I'm like, listen, I'm only telling you what I would tell my family, because I do, and it's not a lie. Like when my family comes into the office, I'm like, you have this going on, you have that going on. They know I don't play. I do deep cleanings on my family members and friends all the time when I see them, because that's what they need. And I'll be truthful and I'll be honest with them, and I let my patients know the same thing. I'm like, listen, if you were my sister, my aunt, my mom, I would let you know this same thing. I'm not just trying to get your money, because if we're being honest, it's not like this money's going directly into your pocket. You know, sometimes you just got to be upfront and honest. You got to catch the vibe from people, because people are skeptical, as they should be. And so you just have to be personable. You have to be like, listen, I treat my patients like, you know, you guys were my family. If my mom was here and I seen this going on in her mouth or on her x-rays, I would honestly let her know the same thing. And then if you do have that history, like sometimes I'm like, listen, I have this that runs in my family and my genes too. So I have to make sure that I'm doing a better job at caring for my gums. And if I'm not, then I know that I'm going to fall into this category of gum disease too. So unfortunately, because of lack of flossing over time, this has occurred. Or unfortunately, because of smoking, this has occurred. Because we know that there's so many different things that cause bone loss, aka periodontal disease, which causes patients to need deep cleanings. So I would say those things, like make sure that you're knowledgeable, you understand the significance of your patient not getting a deep cleaning, which is basically if you don't get your periodontal disease under control, which is the reason why we do deep cleanings, you're losing bone that supports your teeth. Eventually you're going to lose so much bone, and this can cause tooth loss. And obviously, you know, your tooth doesn't always just fall out or just become loose. It's more than likely going to have some type of pain or infection associated with that. So we want to avoid that and make sure that we're keeping your body healthy by doing this deep cleaning. And I always tell my patients this. I learned it from school from my teacher, who told us one day. She said, everything that occurs in your mouth, the bacteria, the bleeding, the gingivitis, periodontal disease, cavities, decay, everything going on in your mouth, you swallow that when you're eating, when you're drinking, or when you're just swallowing your saliva. And all of that bacteria has the opportunity to flow through your blood, flow through your body, and affect your body health. Gum disease is directly linked with heart diseases, diabetes, and other things. So you have to make sure that you are educating your patients and stressing urgency. I get it. Sometimes it might not be like, oh, okay, this is a do or die situation. But for me, I always let my patients know, hey, we caught this at a really good point. It's an early stage of a gum disease, but let's go ahead and nip this in the bud. It's a great thing that we caught it here at this stage. Now we can treat it accordingly and make sure that we're going towards a lifetime care for your teeth. For me, as a dental hygienist, in this generation, I want to make sure that my patients keep their teeth forever. I really don't want my patients ending up in dentures when they're 60, 70, 80, or 90. I don't. I want us to keep our teeth because we have the knowledge and we have the technology to do so. So there's no reason why we can't. So the next scenario, and I believe that this is very common, but it says, what if the doctor's diagnosis does not align with mine? Now, as a dental hygienist, you know that we are not allowed to diagnose. That is the doctor's job. But that doesn't mean that we're stupid, right? Okay, so we see things too. Like we see the x-rays, we check for gum disease because we're the ones taking the x-rays, we're the ones doing the measurements. We can see that the patient has decay. We can see that the patient has gum disease and bone loss. But sometimes the doctor does not agree. So what do we do? First things first, when you're at your interview or your working interview, and I always recommend, if you're gonna be thinking about taking a job, go in for a working interview, go in for shadowing, and have conversations one of the main things that you should have a conversation about at your working interview is your doctor's diagnosis and expectations. So I would bring up certain scenarios. You can go to the extreme of just like, hey, I have these few, dental cases. You can have pictures of x-rays. You'd be like, what would you prescribe for a patient that has this going on? And it could be a tooth with an interproximal cavity. Maybe it's not huge, but it's there. And you can show them that. What would you prescribe for that? Would your doctor recommend to monitor the tooth? Would your doctor recommend a filling, a crown, a root canal? Those are things that you take into account for yourself when you're going into this job, because we have some dentists who are very preservative. They like to wait, they like to monitor and wait until things get bad. That's not really what I like to do. I like to catch things earlier on. So if my doctors, if I bring that to the doctor's attention and it's a obvious cavity and they're like, oh, let's just monitor this, it should be fine, we'll just see how it goes. And if it's pretty significant, I'm gonna be giving a side eye. That's the same thing when it comes to hygiene. If you show your doctor a picture of an x-ray and the patient has horizontal bone loss, and you're thinking in your mind that this patient is a definite SRP or deep cleaning case, and the doctor's like, no, I wouldn't do a deep cleaning on that. That's something that you have to take into account. Is this the office for you? So you can do those specific things. That's very important. Getting on the same page as your doctor, making sure that your diagnosis and his diagnosis or her diagnosis will line up, and that is something that you're comfortable with. Because even as dental hygienists, although we're not doctors, we're not able to diagnose, we still understand ethicality. We still want to be ethical. We care about our patients. We want our patients to have the best treatment possible. If you already have had that conversation about your doctor's expectations and you just feel like things just aren't aligning still, have that conversation with your doctor. Just be like, hey, I just want to understand what you see. I want to get on the same page as you. You are the one doing the diagnosing, but I want to make sure that I'm not telling, because for me in my office, we do something where we basically pre-explain what's going on before the dentist gets in. So I say, no, I'm not diagnosing anything, but I'm like, hey, I see a suspicious area right here on tooth number 3. And I'll show the patient the x-ray. It looks a little bit dark to me. Doctor's gonna let us know exactly what this is, what's going on. This tooth may need a filling, or this tooth may need a crown. I can't sit here telling my patients, this tooth may need this tooth may need that, pre-explaining, and then the dentist comes in and he's just like, okay, everything looks great. That's really hard, and I have personal experience with that. So it's important to have a conversation with your doctor whenever possible and attempt to get on the same page with your doctor. I understand sometimes that's very difficult. Trust me, I understand, but it is something to attempt. It is out of your hands. It is the doctor's diagnosis. It is on his license or her license at the end of the day. But if it becomes to the point where it's so unethical, I do believe that you should walk away and find the office that fits you, because you don't want to be working in an office where you know that things just aren't being done right at all. So the next question, or the next scenario, what if the patient is being difficult and doesn't want to lay all the way back? So someone had asked me this question. Someone had basically said, what if there is no, because sometimes the patient can't lay all the way back. We have older patients that have back issues, maybe just had a recent surgery, things like that. And what if they can't lay all the way back in the chair? But this question had said, what if there is none of that, right? And the patient's just like, no, I just don't feel comfortable going all the way back there. That's hard, right? Because we can't be like, oh, well, what I would really want to say, I would be like, you came to my place of work and you expect me to break my back? Absolutely not. No, that's not how this is gonna work. this can't work like that, babe. No. But professionally, we will be professional. Yes, we will. Yes, we will. We will be professional. So what I would do is I would be open and honest with my patients. Open and honest. I'll be like, listen, it's really important that I put you in a good position that I can see everything. And you don't have to say this, but I want you to remember this as a dental professional. Your health first, like your comfortability first, because these patients are only coming in twice a year unless they have a lot of treatment. But more than likely, they're only coming in twice a year, 30-40 minutes at a time, and we need them to lean back. As dental hygienists, we are constantly risking our health of our back. Every time I talk about it, I be getting a little cramped up. Every time I talk about my back, I realize that it hurts. But no, seriously, like as dental hygienists, we are constantly risking our neck and our backs. So your patients have to be where it's most comfortable for you first. Unless it's like a serious health condition where you can really see like your patients like older, you could see, you know, honest signs of them like really like this really might bother them or hurt them if I lean them all the way back. And you don't need to say anything snooty. I had, you know, just been on the internet and I had seen like a comment of someone saying like, well, I tell my patients, how do you sleep at night? I don't believe in saying anything snooty like that, but just being honest, being like, listen, I have to do this all day long and it's hurtful to my body. So as much as possible, I need you to comply with, you know, the position that I need you to be in. Like I'll reassure them, hey, as long as you've been taking care of your teeth, this should be a quick appointment. But it's really important that we have you in the position where we need you at in order for me to properly clean your teeth, in order for me to properly treat you, in order for me to also not hurt my body, because this is something that I'm doing all day long. In order for me to properly clean your teeth, I need you in a specific position, which is laid back on your back. You know, I'm not flipping you upside down or anything like that. It would be like kind of like how you're laying down on a bed. And that's how I would treat it. Be kind, be respectful, be honest. So yes. Now, if they do have back issues and things like that, I still won't sit there and allow this. Some patients just don't want to go back at all. I'm like, I'm sorry, I have to put you back somewhat, and I can give you time to be comfortable. I can offer you a neck pillow. We can try to figure this out to make you most comfortable, but I cannot do your cleaning with you sitting straight up. I'm not gonna be able to clean your teeth properly, and I don't wanna do an injustice for you. I need you to lean back a little bit. Like I need to get you in a semi-comfortable place in order for me to properly clean your teeth. So don't allow people, don't be like a pushover. Don't allow people to just be like, yep, I ain't going back at all. Like, no, you're gonna have to go back just a little bit in order to be treated, because I physically and like literally cannot do your cleaning with you sitting straight up. Like you need to come back a little bit and we could like adjust. We could get some pillows. If your office doesn't have pillows, I highly recommend pillows and blankets. They're so helpful. But maybe you got a towel, maybe you got a lab jacket, something to give the patient cushion, adjusting the headrest for them to get as comfortable as possible. But we can't do the whole sitting straight up. No. All right, guys, the next scenario is, what if my patient rejects x-rays? So as dental professionals, for me, I've been doing this for 8 years. I can't count how many people have attempted to reject x-rays. And it's very simple because it is a legal thing. We have to have x-rays every year, period. Like if you haven't had a full mouth series in the past 3 to 5 years, we need to update a full mouth series of your teeth. And that's just is what it is. It's a legal thing for doctors. If the doctor's seeing you without x-rays on file within the last year, they can be at risk, and you need to let your patient know that. Some of the time I have been in cases where, you know, patients are like so against x-rays, the doctor may try to work with the patient and be like, okay, you know, as long as you have a low caries risk, meaning that you don't have a high possibility of catching cavities, and we can tell that by experience. How many fillings has this patient had within the last year or two, how many cavities had they needed, how many crowns, on all these things. If you are a low risk patient for cavities, I've seen some doctors say, okay, we will take it every other year. That is completely up to the doctor. If your patient's rejecting x-rays, I would educate them, let them know, hey, these are digital x-rays, because most of us are using digital, and they have extremely low radiation. There's also charts that I would print up. I used to have one in my old operatory in my old office, where it would show, like, you know, if you ate 3 bananas, like I'm not getting it right, but I'm just saying, for example, they would say, okay, if you ate 3 bananas today, then you got 10 times as much radiation that we're taking here, getting these 4 x-rays or something like that, just for example. But there's charts like that, so that would be a really good thing to do if you struggle with having that conversation with patients. Print up that picture and laminate it, or see if you can order it online and have like a big laminated picture in your operatory that just shows the patients, and you can refer to it. You could be like, hey, I know you're worried about these 4 x-rays we need to take today, or even this full mouth series we need to take, but I just want to let you know that this is 5 times less radiation as you sitting at the beach for 5 hours tanning. Like, let's be for real. But, you know, not in a snooty way, not in a cocky way, because people just don't know. We're the dental professionals. We went to school for this. Our jobs is to educate. So that's what we do, and we do it in a kind, professional manner. Okay? Keep it classy. Keep it classy. So yeah, that's how I would go about that. I'm not gonna sit here and argue with the patient for hours about x-rays. I'm like, I do want to get down to the bottom of what's your why don't you want to take these x-rays. If it's finances, please don't bother me about finances. I got a job to do and I got a schedule to stay on. I'm like, you know, you need to talk with you guys, whoever, you know, is in your office. I know my office personally doesn't make a big deal out of x-rays and payments for x-rays. So if their x-rays get denied, we'll write it off. But that's a conversation you need to have with your office to see if, like, you know, with these x-rays, how can we get this flowing better? Can we write off some of these x-rays? Or if that's just not an option, you need to bring your doctor in and have your doctor talk to the patient. And maybe this just is not the office for that patient, but, you know, the doctor would usually be the one to dismiss. Or some doctors, you know, they trust their hygienist. So like, let the patient know, if you don't get x-rays today, we cannot see you. Especially new patients. I love when I get a new patient coming in and I'm like, when was your last cleaning? 4 years ago. Okay, we need to take some x-rays. Oh, no, I just came for a cleaning. Sweetie, please, we don't know you. We have never heard of you in our lives. We need to see what's going on in your mouth before we just start cleaning up in there. Absolutely not. Illegal. Okay guys, we got one more scenario, okay? So this last one is, what if I don't have enough time to do everything in one appointment? This is definitely for my hygienist out there. Now, I talked about this before, but they have an issue. Hygienists, we get paid well, but it's not an easy job. I can't complain about my job. I'm thankful. I believe that it's a good paying field, but it's not always easy. It's not always as easy as people would think that it is. Like, we have to stay on a schedule all day long, and we're seeing patient after patient, and sometimes the appointment times just ain't enough time. So the number one thing is, before you take a job, ask them how long your appointments are, period. If they're saying 40 minutes, run. I'm just gonna tell you from experience. My first dental hygiene job was a crap show, so that doesn't even count. We had like 10 minutes, and really, in reality, we had like 10 minutes to do cleanings, but we won't talk about that. My first like real job in dental hygiene, we had 40 minutes to do cleanings, And that was with cleanings, exam, x-rays, like whatever the patient need. Even if they needed a full mouth series, it was 40 minutes. And that was honestly horrible. It was honestly horrible. Good thing by the time I left that office, we were getting increased time. So that was a good thing, especially because they had added in the iTero scanner around that time. So we were like, that's fine, but we need more time. We're not about to be breaking our backs to do all this in 40 minutes. Like, something's gonna get skipped. So I would say that number one, make sure you have enough time. Make sure you talk with your office and be like, how much time do you guys give for all this stuff? And like really advocate and like go in and like get what you need and like advocate for yourself. Like, listen, this is not, I can't treat my patients well with 30-40 minute appointments. It's not right. It's not fair to me. It's not fair to the patients, and they deserve better. So if you're already in it though, and you only have 40 minutes and you're trying to figure out how am I gonna get all this stuff done, number one, that's hard for me because I've been doing this for 8 years. And till this day, I hate 40-minute appointments. So what can you do? What I would do is, number one, I would have a conversation with my team. I would have a conversation with whoever's doing the schedule, with my manager, with my doctor, letting them know, okay, 40 minutes is not enough time, 50 minutes, whatever you're getting that you feel like is not enough time, I will let them know this is not enough time. And I require 10, 15, 20 minutes more to get this done, right? Because sometimes in a cleaning appointment, they could need x-rays. Sometimes it could be a series of 4 x-rays, or sometimes it could be a series of 18 x-rays. You need an exam with the doctor. We all know we be waiting for them doctors. No offense, no tea, no shade, but we be waiting for them doctors. And then we need to do the cleaning. No tea, no shade, but these patients don't be cleaning their teeth at home. So it'd be a lot more than what we're expecting. So we'll have that conversation. Now, if you have that conversation and they're just like, hey, we can't budge on the times, you need to come up with a plan. And you need to be like, if you guys are only gonna give me, you have to like stand strong and not be a pushover. Once again, don't be no pushover. Stand strong and let them know, hey, if this is not something that we can change, if we need to keep the appointments at this length, I'm gonna let you know what I can do. And this is what I recommend. You need to make sure that the doctor and your manager, whoever is in charge, is on board with you having an assistant to help you out, especially if you don't already have a hygiene assistant. Whatever assistants are in the office, and sometimes the girls that work at the front desk have certificates for x-rays because they are ex-dental assistants and whatever else. So sometimes they have certificates too. You need to be like, I need teamwork. If you guys are going to be scheduling me like this short of an appointment, I'm going to do my job. And maybe at the beginning of the appointment, you go ahead, you get the patient's health history, chief complaint, you do your perio charting, and you do your cleaning. Now, after you're done with that, then I would say I need a team member to come help me to take the x-rays and do the exam and finish up the exam at the end of this appointment. If you schedule back your patients yourself, you could do that at the beginning of the appointment, or you can be like, and I also need them to schedule the patient back, okay? Or as they're checking out, that'll be something the front desk could do in this scenario if you just don't have enough time. Now, if this is an all day long thing where they just like always give you this short appointment, now to me, an appropriate appointment time, the best time is 60 minutes, 1 hour per patient. I can work with 50. I can't work with under 50. 40 minutes, 30 minutes, if you're gonna give me 40, 30 minutes to do things, even sometimes 50 minutes if the patient needs full mouth series. This is a case where I'm gonna be like, I need a dental assistant. I need somebody in the front to come back, help me out, help me to finish off this appointment. I'm gonna start with the cleaning. Then I need y'all to sit in the room and wait for the doctor exam. Or when the doctor comes over, I need him to be able to grab one of you guys to do the exam with them, or to take the x-rays and do the exam with doctor and get them scheduled back. Like basically just to finish up this appointment. And then I need you to flip that room too, because now I've already moved on to the next room and I got my patient in another room. and I'm gonna need this room clean because once I'm done with this patient, I done already ran over, I'm already stressed and annoyed. I need to come back to my room cleaned, okay? Not in a cocky way, in a kind way. But one thing that I like to advocate for on my job, and it's really hard, really hard. I'm in a really tough situation right now, but I like to advocate for the fact that as dental hygienists, we are also providers. We're making money for the office because we're bringing patients in, we're treating them as well as a doctor. So we want to be respected as so, and when we need help, we need help. The doctors run around, they got somebody with them at all times. I'm not saying that we need that too, because we're independent, we could do our own thing, but we also need help when it comes to flipping rooms, doing different things. So I would make sure that you're in a good office environment for that. I made the mistake. Please learn from my mistake of just being in an environment where, you know, you don't always have the help that you need and you're not always respected as a provider. So be careful with where you're going. Make sure in your working interviews, you're really observing. You give yourself enough time to like truly observe, to ask questions to the current employees. And be picky and be particular about what you're getting yourself into. Not everything is going to be about money. A lot of things are just about peace. Like, I want peace. Every day I wake up and I'm like, God, I just need your peace today. Like, that has been my prayer lately, is just like, God, I'm not worried about my future. I'm not worried about my past. I need your peace right now in this moment. I don't want to worry. I just need your peace. And it's been very helpful. So guys, I love you all. I hope that you enjoyed this video. I hope that this video was informative. I hope that the information in here was useful. And I will see you all in the next video. Blessings.